Hi, my name is Suzanne Patterson. I'm a graduate of the 3,000-hour RMT program. I've been in RMT for 8 years, and we will be discussing draping of a male client who potentially has a groin sprain. So we're going to be treating in the adductor and inguinal area, and we might need to treat pectineus, adductor longus, and quadriceps. So this particular draping style is very helpful. Before you start treatment, you want to make sure that your client knows exactly what you're going to do before you do it. Female therapist to male, you need to have very direct instructions for them to understand what the goal here is. So you've come in with a groin sprain, and we're going to be draping up high to the ASIS of the hip so that I have access to the inguinal area. Are you okay with that? Get consent. And then address that in this area, because we're going to be draping up higher, I'm going to need you to adjust yourself to the left so that we don't pinch anything in the way. So if your client doesn't understand what you're trying to get at, which is to ask them to move their genitals over so that when you're draping up, you don't actually pinch anything. They will appreciate that. So if they don't clue in and say adjust yourself to the left and they just move their body over to the left, that's not what you want. There might be a language barrier so they don't understand. That's when you can use the language of please adjust your genitals to the left so that we don't pinch anything as we're draping. Okay? So first, I always like to use a blanket. It just gives a little bit extra support and it helps keep the sheets better in place. We'll just move that over to the side. Again, finding your edges and corners. Take the edge and only uncover the knee. Once you've uncovered the knee, make sure that your edge is perfectly seen. You can support the knee, grab the edge, and make sure that you've got the leg in nice and tight and your biomechanics are good. If the limb is a little bit heavier, you can ask them to assist you in lifting their leg a little bit. And you're just going to pull down as far as the sheet will let you go. Okay, so I'm just pulling down and up. Then let the leg go. Again, you can remind the client if they haven't adjusted themselves to the left, this is where we're going to be draping up nice and high. So have you adjusted yourself to the left? Mm-hmm. Perfect. So then you're going to take the edge of that sheet and you're going to be pulling on that sheet and then moving the excess out of the way. Now we find the ASIS and tuck in. Use the blanket to further reinforce that. And now we have access to this area. If you need to move the leg around, you can actually ask them to hold the sheet tight here and here, these two pieces. Yeah. And I want you to keep that nice and snug so that if I have to, I can actually externally rotate the leg with support with a pillow, and now I have complete access to these structures. So I can palpate the origin all the way down to the insertion without any exposure, and then helping the client back into neutral position. Other options for treatment is using the ProStim blade. Still getting the client to pull tight on the sheet. You can externally rotate and you can actually have access to full structures. The draping is your border or guideline and you can just go right to there. If you need to, you can actually treat a little bit over the sheet if you feel that you can't actually reach the origin. Once treatment is done, in order to get out of the draping, you can ask them to let go of the draping. You can pull out from the side and then just move the sheet down. And your bottom sheet, you'll know where your corner is right here. All you have to do is pull that down and then lift the leg and pull down again. And the client is completely covered without any exposure. We are just transitioning to get the client into a side-lying position to continue treating the adductor muscle. So to help that client turn over, make sure you grab the sheet, explain that you're going to create a privacy curtain between you and them so that they can turn over onto their side without being exposed. So when you're ready, I'll get you to turn over onto your right side and face the wall. And please let me know when you've done so. Okay. All right, and place the sheet back down. Okay. So in this scenario, he already knows that he's coming in for a groin sprain. We need to treat the adductor muscle. So I have already gotten consent from him in order to do this, but I'm going to explain to him some of the draping technique before I do it. So what I'm going to do is get your right leg nice and straight, and your upper leg will be in 90 degrees. Okay, so now we know that we have the leg that we need to be treating is straight. We will uncover the blankets like so. Okay. And we're just going to get you to move your leg a little bit off of your knee. Yeah, so because we need to work on this leg. So this leg, yeah, perfect, just like that. So again, the leg will be looking like this. Okay. So again, find your corner and edge. And I like to always tuck in at the glute just to make sure that you have an anchor. Okay. You're going to support the leg again and grab your edge and pull the sheet through like this. At this point, your client can reach down in between the legs and grab the sheet to pull up.
That one?
Yep, perfect. So now I have a nice clear border across. And do you feel tight and secure in this draping?
Sure.
Yep, perfect. So now we have all of this muscle tissue accessed with nothing exposed. I can go in and actually treat the adductor almost right up to the origin. I can actually palpate the inside of the ischium for the hamstring right in through here and treat all of this area. To further your separation from your client, you can use the ProStim blade to actually reach the origin without actually having to have your hand there. And just pushing through here, changing over, and pushing up. And always communicate with your client. Does this feel okay? Do you feel secure in this draping? Always having clear communication with your client. Another variation to treat some of the origin without having to use your own hand is to use the TriStar blade and just get in a little bit deeper. Again, without having to use your own fingers and to get some nice deep tissue work done. Once you've treated the leg, in order to come out of this draping, again, we want to untuck in through here. And if they are holding the drape in between the legs, we'll ask them to let go of that so that we can pull that down. So now we've got good coverage here. Again, we're just going to support the knee, grab our other edge, and pull out. Recover the leg and place the blanket over top.